So today we're doing joint mobilizations, and we're going to start at the tibiofemoral. So grade 1, you apply small amplitude and you apply small resistance, so it's like barely moving it at all, and it is just the beginning of joint play. And you just go like this, you just move it forward and backwards. And this helps with pain modulation. And grade 2, you apply a little bit of traction downwards, and you pull a little harder towards you, but it's still just in the middle of joint play. And it is also working on pain modulation. Grade 3, you apply traction again, and this one is the middle to end range of motion. So a little bit harder and still small amplitude. And this works with increasing tissue mobility. Grade 4, that will go to the end of range of motion, so you'll feel like the ACL and PCL kick in. So you apply traction, and you push in and pull out, and you can just feel the ACL clicking. And that also helps with tissue mobility. And then we will go to the second MCP joint. And since it's a smaller joint, it doesn't have much stability, it doesn't require as much force as the knee. So again, you apply traction, and for grade 1, you just barely move it up and down, small amplitudes, and it's working on pain modulation. Grade 2, you apply some traction, and you go to the middle joint play. And this one also helps with pain modulation. Grade 3, you go a little further to the middle to end range of motion. And this works on tissue elongation, or tissue mobility. And then grade 4, traction, and you go to the end of play, end of joint play. And this works on tissue mobility as well. And then at the glenohumeral joint, you have them lay down and scoot off to the edge. And for grade 1, you grab the humerus and then you stabilize above here. And then for grade 1, you just go at the beginning of joint play. And this helps with pain modulation again. Grade 2, you apply some traction and you move it a little bit. The amplitude's a little stronger. And this also works with pain modulation. Grade 3, you grab it again and you pull, and you go up and down, and this one's to the middle to end of joint play. And then grade 4, you go to the end of joint play, and you can really feel it. And both of those last two work with tissue mobility. And that's how you do joint mobs.